So this is in the Sculptra book, and what it's saying is that by the age of 18, or at the age of 18, we have this beautiful dermis, and then it starts to lose collagen at the age of 40, and you can see that slope go downward. And when they see the visual of the slope going downward, and in the book there's I think it's like a 25-year-old face and a 45-year-old face, and every single one of my patients that I say, oh, you should do Sculptra, they look at the 45-year-old face and they're like, that's me. I'm like, look how you can get to the other way. And so it makes sense to them, the dermis. All right, what's the next one?
So let's go to the next one.
Exactly.
How does Sculptra work? So I break it down so easy for my patient, because if you use, that's just me. I feel like you want to make them understand what is this Sculptra. The way I break it down so easy, I'm like, look, it's a copy paste. If it's injected to the dermis, it's going to help you with the collagen. If it's injected to the a little bit fat pad sub-Q, it gives you a little bit more volume. And that's why off-label patient, they do this treatment for butt enhancement, and it works. Whether they need some volume, perhaps they had a BBL and maybe there's just one little area they just want to make it more even, use Sculptra. Or if their one hip is asymmetrical than the other, so it can be used for the body, and the patient gets such a nice result. And then for me, one thing, I go back again, I'm like, look, I can use filler for volume loss, toxin to prevention of line wrinkles, Morpheus 8 that we all love, like Nurse Rona. I know you love it.
I just did IPL and Morpheus to my face.
We all love this Sculptra, Morpheus 8. But then with the Sculptra, what we can do is not only give you that glow touching the skin, but then your bone support. Your bone support is important to me.
Real quick for that.
Yes,
I think, again, you guys got to get the elevator pitch down if you want to start to inject it, because at the end of the day, we are salespeople. You have to sell it first. Isn't that weird? I used to actually do sales. I'm like, oh, I gotta go back to that. But it's how you talk about it. So how I talk about it to my patients, because again, they're looking through me when I'm talking about it. I'm like, think about your lawn. When you seed your lawn, you don't see a difference right away. You wait, and then I say it because I don't seed my lawn. I'm like, I don't know how long my husband waits, but it does grow at some point. But with Sculptra, we have to wait for 3 months for the lawn to grow. So we're gonna seed the face, we're gonna wait, and then in 3 months, the lawn's beautiful, nice and green. Same thing with the face. You have to wait. You have to wait. And if you do not tell them about the waiting process, they'll come back in 2 weeks and they'll say, I want my money back. You suck. Nothing's wrong with, or nothing's different with my face. And you're like, yeah, you're right. Nothing is different. Didn't I tell you that it's going to take 3 to 6 months to see? So set the stage. Everything you do with Sculptra, I think it's the hardest product for injectors because it's a lot of talking, it's a lot of explanation, and it's a lot of teaching. And so you have to have that art of teaching, selling, but once you get it down, they'll understand it. And I think a lot of people do get the seeding the lawn. I forget who taught me that, but it was in one of the Sculptra trainings that I did.
And then anything good happens through time. That's why you can see that a lot of, in our industry, I would say 3 out of 5, they have pillow faces. Because they want that instant result. They want that instant patient, especially in America. Mm-hmm. I grew up in Iran, so I have seen a totally different culture. People don't have problem with waiting, but this is a fast-paced country. Everything fast, like your Starbucks, your coffee, everything. You want it right now. There's no tomorrow for people in this country. So they want that instant, enhancement or lift or everything. But you just have to educate your patient. Anything good comes through time. And because sometimes with Sculptra, they don't see the result right away, they may be a little discouraged. So it's our job to educate our patient that, look, long term, I'm helping you to maintain your skin quality and the glow. One thing with Sculptra that I will swear on it is the glow that you receive through this treatment. Again, I have so much love. You have so much love. Ms. Rona has so much love for Morpheus 8, and we'll love it. And it is a skin tightening, but this medication is a little bit different because it also will give you that glow and help with it, smoothing the lines and some of the marinade line or nasolabial fold.
Yep.